Okay, I'm going to go ahead and get us started. For those of you that are introducing yourselves, please go ahead and continue to do so. Just a couple of logistics for those of you joining us today. If you have any questions throughout the presentation today, please include those and your thoughts in the chat function. We will be tracking that and want to make sure we capture your questions when we open it up for our dialogue. This webinar today will be recorded and will be sent out to all of you that registered for the webinar. So no worries if you're not able to jot down all of the information. The webinar is being recorded and will be sent your way. In addition, at the end of the presentation, there will be a link to the final report. We'll also include it in the chat and want to make sure that you all have access to the vital information that's included in that report. So it will be included in the chat as well as the presentation and in our follow-up communication to you with the recording link. Thank you so much for joining us today. So good afternoon, everyone. Again, thank you so much for being with us. My name is Myra Alvarez. I have the honor of serving as president of the Children's Partnership. For those of you that don't know us, the Children's Partnership is a statewide policy and advocacy organization based in California and focused on child health and well-being. And we are honored to be a part of this important webinar with you today. As I read the chat, I'm encouraged by some of the words we're seeing about how people are feeling right now: optimistic, hopeful, relief, determined, empowered, all words that I think each of us that are part of this webinar today want to put in front of every young child that we know. And it really brings a great sense of energy for the conversation that we're about to have today. We're so glad you're with us. We have on this webinar, as part of our panelists and as part of our audience, a diverse group of advocates, providers, family members, educators, and more, all of us with a shared goal of providing every child in California and across this nation the resources and opportunities they need to thrive. We at the Children's Partnership are fortunate to co-sponsor today's webinar with the Center for District Innovation and Leadership in Early Education and Advancement Project California, and to have as our special guests the Children's Equity Project. As a brief overview of what to expect today, we're going to hear first and foremost from the director of the Children's Equity Project, Chantel Meek, who will present the findings of the report, Start with Equity California. It's a new report that was just released today that outlines early childhood inequities in discipline, disabilities, and dual language learning. Over the summer, the Children's Equity Project released a similar national report, but today's report zooms into the California context, using California data and making California-specific policy recommendations, a critical opportunity to inform California's master plan effort. After Chantel presents, we will hear from Carla Bryant, Executive Director of the Center for District Innovation and Leadership in Early Education. Carla brings over 30 years of national experience creating culturally competent policies, programs, and procedures for comprehensive early learning programs. She'll provide a response to the data and begin our conversation around where does California go from here. She's bringing professional expertise, but also personal expertise as a mom. After Carla presents, we're going to hand it over to Emma Watson with Advancement Project California to facilitate a dialogue with our audience. But again, the hour is going to go quickly. So if you have questions that come up during the presentation, please include those in the chat. We want this to be a conversation throughout today's webinar. So really quickly, before I hand it over to Chantel, I want to talk just a few minutes about our 3 California-based organizations and how we work together. Together, we're part of the Whole Child Equity Partnership organized by Advancement Project California. Together, our goal is to move much of this work forward and reimagine how we define need in California in order to advance a whole child approach to better address the complexity and the historic underinvestment and divestment from communities of color and their children. As you will hear today, there is significant importance in ensuring we have the data that captures the racial, cultural, and linguistic assets of our young learners so that we may better serve them. Through a targeted universalism lens, the report highlights the need for a focused approach to use an equity index to target funding into the highest need areas to support our youngest learners. And as we head into what we know will be a challenging year, a challenging next few years, we look forward to working with all of you to ensure California does all it can to support its youngest. When considering a child's health, their housing situation, their learning environment, or other factors where they live, learn, develop, and play, we have an opportunity to challenge the systems of today and better serve our youngest Californians. And we thank you for being with us. With that, I have the pleasure of handing it over to Chantel Meek, Executive Director of the Children's Equity Project.
Thank you, Maida. I am really thrilled to be here with you all this afternoon and to be partnering with Maida at the Children's Partnership and Carla at the Center for District Innovation and Leadership in Early Education, and Emma, of course, with the Advancement Project California. And to talk to you all a little bit about this new report we released today, Start with Equity in California. So I'm going to ask Janiqua if she could please start the slide deck so we can start moving. Great. So we can go forward to the next one. So just super quick off the top, Maida mentioned a little bit up the top, but the Children's Equity Project is really a national initiative that's focused on dismantling systemic racism within learning settings from kind of the early years through the early grades and closing opportunities so that every kid can thrive. We work kind of at the nexus of research, policy, and practice. And we're housed at Arizona State University, but really led in partnership with researchers and advocates in 16 other universities and nonprofits across the United States. Next slide. So here's a list of all of our partners and all of the folks who make up the CEP within these institutions, but I won't read them all off to you because we have a lot of rich information to get to. Next slide. Great. So as Maida mentioned, earlier this year, we released a big national report looking at 3 specific areas within equity, with the thinking that if we address these 3 areas, we're not going to address all of the inequities in our system, let alone all of the inequities that young children face across multiple different systems and their families. But if we can target and identify kind of where systemic racism, where inequities in resources and differential treatment are happening within our system, we can have a much more kind of targeted and actionable approach to implementing reforms across these systems. And so the 3 target areas that we chose to focus on were harsh discipline and its disproportionate application in learning settings, the lack of inclusion or really the segregation of young kids with disabilities, and really the inequitable access to high quality learning, and in particular bilingual learning for dual language learners and English learners. Next slide, please. So across these 3 areas, we'll start with harsh discipline. So for this particular report where we zoom in on California, we looked at these same 3 issue areas and we dug in and looked at data specific to California, the policy landscape specific to California, and then provide some actionable policy recommendations specific to that state context and kind of to inform the master plan, but all related efforts in addition to that. So starting with harsh discipline, when we wrote our report, we defined harsh discipline, including corporal punishment, expulsion, suspension, seclusion, which is locking a child in a room by themselves without the ability to get out, and restraint, of which there are many forms, including manual restraint, which is holding a child, and mechanical restraint, which is using some kind of device to restrain a child. Next slide, please. So what we know, we'll start with a really brief overview of kind of the research and data nationally broadly. So we know that these harsh forms of discipline, especially suspension and expulsion, start early. We know that they're disproportionately applied to Black children, to boys, and to children with disabilities. We know that there is not a shred of evidence that any of these forms of harsh discipline actually result in anything positive for the child, for the teacher, for the classroom, for anybody else. But we know also that there's an abundance of evidence that shows that it has negative effects on the child long-term in a variety of different areas, which we'll talk about. We know that there is no evidence that Black children in particular, who are the ones who are most consistently overrepresented in this type of discipline, have any worse behavior. They don't have more frequent misbehavior. There's not a difference in the actual behavior. But what we do know is that a lot of these disparities are driven by bias, implicit biases, explicit biases, by inadequate training or not targeted enough training, by misguided policies, by poor working conditions for the workforce, for lack of supportive resources like coaching and training and a helpline, and school climate. We know that there are a handful of interventions, widely scaled interventions and approaches that decrease exclusionary discipline, but there hasn't been a targeted enough approach in identifying how those interventions close disparities. Although PBIS in particular is one of the most promising models that has done more in that space. We know that rates and disparities of harsh discipline vary between and even within state lines, as we'll talk about in California. We also know that on the policy front, these issues are largely unregulated at the federal level, and they really fall at the state and local level. After 2014, when there was a whole bunch of federal policy looking at exclusionary discipline in particular, there was a whole wave of state level policy that happened. But really the quality of those policies, the extent or how wide and how many children were actually received any protections really varied. The number of behaviors that you could be suspended or expelled for in some places was very short, in some places was very long. So we saw quality of the actual policies vary a lot, even though we saw a big wave in actual quantity. Next slide, please. So if we look at California, maybe not surprising to a lot of folks here, but there's really no state level data publicly available on these harsh types of discipline in California. The only California specific data is really the federal civil rights data collection from the US Department of Education, which only covers public pre-K programs. So there isn't any data on the various childcare systems, which research suggests may have higher rates for a variety of reasons, the primary being the lack of resources and lower levels of funding. So this federal civil rights data collection from the 2017-18 school year in California found that 1,754 public preschool programs reported. They only reported 15 suspensions in the whole state from the preschool program. I won't go through all of the demographics, but you can see that the majority of those kids, 14 out of the 15, were Latino, Latina, Latinx. One was white. Most were boys. A little less than half had disabilities, and a couple were English learners. Next slide, please. So the policy landscape in discipline. We know that in 2017, AB 752 was passed that limits expulsion, but it only applies to public preschool programs, and it does not address issues of suspension. We know that later AB 2698 was passed that financially incentivizes mental health consultation via childcare reimbursement. I think that was a really, really, really important bill to get at the prevention side of it. And we didn't mention mental health consultation earlier when I was talking about those models to address these issues, but it is also an important model that is pretty widely scaled across the country, but also has a lot of work to do in better investigating and centering kind of closing disparities as opposed to just looking at outcomes in general. We know that there's no policies limiting exclusionary discipline in the childcare systems in the state. And according to the state's 2019-2021 childcare plan that's reported to the federal government every few years, the state listed that they developed a website with some prevention resources on this issue, and were requiring licensing inspectors to attend training on this issue. So not really extensive stuff in terms of prevention or addressing the issue, and not at all addressing the inequities that we see in general nationally. In terms of the corporal punishment space, California is one of the 48 states that allow corporal punishment to happen in private schools. still. But it is prohibited in public schools and in center and home-based childcare. Seclusion and mechanical restraint are explicitly prohibited in center-based childcare, but actually omitted in the home-based childcare rules. Next slide, please. So taking all of this, and I'm kind of flying through this because we don't, an hour passes by fast. But here are the recommendations kind of based on those data, based on all of the research that we've reviewed, and based on the specific context in California. The first is really to prohibit corporal punishment in private schools as well. There are 2 states that have done that. And there's, I don't think, any instance in which corporal punishment is okay for any age child, let alone young children. The second is really to align kind of the home-based childcare standards with center-based standards in the explicit prohibition of seclusion and mechanical restraint. The third is really to prohibit suspension and expulsion across all programs that serve young kids and receive public funding, including CalWORKs childcare and other kind of general childcare and development programs. Just make it consistent across all the programs that get public funding, so that a child's protections don't depend on what system they happen to be a part of or what funding stream kind of supports their program. The other piece is really working with the state's systems of higher ed to really work on preparation and professional development pieces, to ensure that issues of systemic racism and bias and disparities, and how really the perceptions of behavior and decisions we make about discipline affect what we do and how we treat children, and what these data are showing us. Really directing state or federally funding training and TA providers to ensure that all these issues are a part of continuous professional development. So embedding all of this stuff in pre-service and preparation, and embedding all of this stuff in continuous professional development. We have to continue kind of talking about it and addressing it across our systems. Next slide, please. So a few more. Really expanding the California State Preschool Program expulsion policy to include a prohibition on suspensions, because right now we know it only includes expulsions. Another method that we've seen some states be really successful in is including a no expulsion or no suspension clause in contracts that the state signs with childcare providers. Investing a greater amount of childcare and development block grant quality funding, as folks know, every state gets a bucket of quality funding to spend on improving the quality of childcare in their states. And so spending a greater amount of that on approaches and interventions that have been shown to reduce not only the rates of exclusionary discipline and harsh forms of discipline, but also disparities within those, like mental health consultation. The next one is really focusing on data. If we are not collecting and disaggregating and analyzing our data on a continuous basis, we are flying blind without really understanding the problem, which really ties our hands in terms of addressing the problem. So really looking at collecting, disaggregating, and publicly reporting data on suspension and expulsion across all the programs that serve young kids and receive public funding. Again, like make it a common a measure there. And really ensuring, we didn't talk about this before, but in early childhood, there are a lot of what we call soft expulsions. So, oh, your child's just not developmentally ready. Oh, it's just not really a good fit. Or, I come in, I call you and ask you to pick up your child, 10 times a month, and then it becomes unsustainable for a family, for a working parent to remain in that program. And so they're kind of pressured to unenroll. So all these forms, all these different forms of exclusion are also expulsions. They're just soft expulsions. So making sure that as we're collecting data, that parents are included as a source of those data. Creating a feedback loop between the state's data collection efforts and the state's professional development system, and ensuring that where we're identifying, look, there's huge disparities here, there's really high rates here, that we are quickly deploying targeted TA resources, coaching to address those issues. The other is really conducting a public information campaign directed at parents to raise awareness about their rights. Parents are kind of going to be the most important partner in implementing kind of these equitable policies, and making sure that they have the knowledge and the awareness of how they can report things, how they can contest decisions is really important. To that end, developing a complaint intake system to receive those parent complaints and actually address them, investigate them and address them would be really important. And finally, providing guidance to counties, to localities, to really include all of these exposure and suspension prevention indicators at all levels of the quality rating system. And we provide a whole number of examples for that here. Next slide, please. So the next area we dug into was the inclusion of kids with disabilities, or on the other hand, the segregation of kids with disabilities. And I want to start with a definition because inclusion can be defined in a lot of different ways and perceived in a lot of different ways. I want to be clear that by inclusion, we don't just mean physically placing a child in a general education classroom. That is not meaningful or holistic inclusion. By inclusion, I'm just going to read this out loud. Inclusion in early childhood programs refers to including children with disabilities in early childhood programs together with their peers without disabilities, holding high expectations and intentionally promoting participation across all learning and social activities, facilitated by individualized accommodations, and using evidence-based services and supports to foster their development, their holistic development. This applies to all young children with disabilities, from those with the mildest disabilities to those with the most significant disabilities. And this is a definition that was used in the inclusion policy statement that was released by the US Departments of Health and Human Services and Education back in 2015. Next slide, please. So based on that definition, here's a little bit of what we know, and I'm going to kind of fly through these, and I encourage you to read the report for a little bit more. But what we know about inclusion, there's a really strong and long-lasting research base that finds that inclusive learning opportunities, high quality inclusive learning opportunities, are good not only for kids with disabilities, but for their peers too. We know that this particular area, inclusion, has also a very strong policy base. There's the Individuals with Disabilities Education Act, which is very clear that young children with disabilities should be placed in the least restrictive environment. But yet, despite this pretty strong, solid kind of statute, and despite this solid and long-lasting research base, progress in expanding inclusive opportunities has been really slow. And this is particularly true for young kids. We know that inclusion varies by disability category, by age, by race, by location. And we know that kind of the biggest problem with in terms of the data and with inclusion is preschoolers. So infants and toddlers, for the most part, are served in the natural environment, which is typically their home. But for preschoolers, less than half of them are receiving services in regular early childhood programs, with the youngest of those preschoolers, 3-year-olds, being the least likely. We know when the kids get a little bit older, Black and Latino school-age kids are less likely to spend most of the school day in a gen ed classroom. And we know that there's a number of barriers that have stood in the way of faster progress. Ableism being primary among them, and kind of these attitudes and beliefs that children with disabilities can't succeed in these programs, that they need, to be separate, or they need other services. Policy and financial barriers are big. There's a lot of perceived or misperceptions in policy and funding issues. Lack of workforce preparation, lack of oversight and accountability, and really a lack of coordination between those special education systems and the general early childhood systems, pre-K childcare. The last thing that I'll say is that we find that public pre-K is an underutilized tool to expand inclusion. Because over the past decade or so, we've seen public pre-K expand and slots expand. We have not seen alongside that inclusion expand of kids with disabilities. So they've kind of been left behind and left in this separate system over here, as opposed to being integrated with their peers in the system. Next slide, please. So here's a little bit of the data for California. We know that in the 2018-2019 school year, about 50,000 infants and toddlers in California received early intervention services. As I mentioned, nationally, as is the case here in California, most of those kiddos received their services in what the Department of Education refers to as a natural environment, typically the home, or in community-based settings. Next slide, please. But preschoolers, the Part B 619 program, which is a preschool special education program, is where the largest problem is in lack of inclusion. We know that about 86,456 kids received preschool special ed services in the state, most of whom received those services in settings separate from their peers. So California is actually quite a bit worse off than even the low national numbers by about 10 percentage points. So only about a third of the state's preschoolers with disabilities receive their special ed services in a regular program. Next slide, please. So we looked at these data by age, we looked at these data by race, and we looked at these data by English learner status as well. And what we found is that across every single of these groups, all of the age groups, all of the racial ethnic groups, the English learner group, there's a lower percentage of kids across all of these groups in California who receive preschool special ed services in inclusive settings compared to the national average. There's not a group that's like doing better or on par. But we do find some disparities within the groups that have an even lower percentage of that. So younger children, which kind of mirrors the national trend, 3-year-olds are the least likely to get services in inclusive settings. And in terms of kind of the racial ethnic piece and language, we see that Asian American children are the most likely to receive services in segregated settings, followed by those who identified in other race category, as well as English learners following them. Next slide, please. So if we look at the policy landscape of inclusion with kids with disabilities, this is actually a space where California has made some important, albeit insufficient progress, but compared to kind of a lot of the moves that have been done by other states, there's been some important progress here. So in 2018, a bill was passed to establish the Inclusive Early Education Expansion Program, which included $167.2 million general fund appropriation to increase access to inclusive early learning programs. So that is important. There are not many states who have kind of dedicated funding to it. It's not enough. And especially given where California is starting from in terms of being well below the national norm, it's not enough, but it is an important important step. There's also been several task forces or statewide groups that have released recommendations. There's also been guidance out of the Department of Education and others kind of reaffirming the support for inclusion. But again, the guidance and many of the task force recommendations are just that, they're recommendations as opposed to anything that's really required. In terms of the workforce, there is a preschool special ed credential, there is a preschool inclusion facilitator certificate, and there is a specific kind of dedicated professional development program aimed at promoting inclusion. Next slide, please. So taking kind of all of this together and looking at our recommendations on inclusion, the first is really to conduct a statewide and district level analysis to identify where those segregated systems are in the state. Where are those places where, you know, a high proportion of your kids with disabilities are in separate classrooms, are in separate settings, are in separate schools, to get a better understanding of where we need to target more resources and energy. The second is really increasing funding for the Inclusive Early Ed Expansion Program and really targeting supports first to the communities with those segregated self-contained systems. The second is ensuring that all of the coaches in the state, so there are many types of coaches, there's quality coaches, instructional coaches, mental health consultants, inclusion should be in everybody's job description. And making sure that kids with disabilities are successfully included should be in everybody's job description, regardless of your kind of specific dimension of coaching. So making sure that that is kind of a blanket requirement and baseline for the coaching infrastructure is critical. Really issuing guidance and holding statewide trainings and raising awareness for IEP and IFSP administrators and teams that review and really drill down on that provision in the law of placing kids in the least restrictive environment. The least restrictive environment, or where the child would be placed if they did not have a disability, should always be the first resort or first consideration, and then work backwards from there if you have to. But we believe, based on research, with the appropriate funding and the appropriate accommodations and the appropriate supports, that all kids with disabilities can be successful in inclusive settings. Next slide, please. The other part, really making sure that any evaluation of the IEEP program includes and comes with an equity lens, and this is true for any evaluation. But making sure that when we're looking at new inclusive slots and opportunities, we're investigating and making sure we're tracking that those are being offered equitably to kids. Again, developing a plan at the state level and working with local counterparts to transition self-contained preschool special ed systems to integrated systems with the local early ed system, whether that's public pre-K, whether that's the childcare system, really kind of working to bring those together. Increasing funding and expanding the state's Better Together effort to assist the transition. Again, this transition we're talking about from self-contained systems and classrooms to integrated and inclusive systems. And we provide some recommendations there on deploying inclusion TA teams to do kind of the hard and actionable work of like looking at budget allocations, looking at staffing structures, looking at the number of slots and communities that are inclusive and where they're at and how we can match those up and link those up with the district. The other piece of this is really aligning California State Preschool Program with the Head Start standard that requires 10% of enrollment be kids with disabilities. And the next one is really conducting a review, and you'll see this recommendation kind of pop up across all these issue areas, but making sure that all of these equity issues, whether it's inclusion, whether it's discipline, promoting positive discipline, is embedded across all of these policies at the state level, including QRIS systems, standards for the different programs, licensing, all of these different areas should have equity at the foundation, at the base. It should not be an add-on that we consider later. And finally, measuring inclusion. So if we're measuring global classroom quality in any way, inclusion should be part of that measurement and making sure that that is incorporated in the monitoring and evaluation and accountability systems. Next slide, please. So the next area focuses on dual language learning. So the data landscape in California for DLLs. And this is Liam Andre. He's my adorable nephew. I love putting him in presentations. So we know that about 60% of California's young kids live in a house where a language other than English or in addition to English is spoken. Most of those folks identify as Hispanic Latino and speak Spanish, but there are many, many languages, as many of you know, and we go into that a little bit in the report. The next largest group is children speaking an Asian language. These kids and families are diverse by almost every measure. Regionally, socioeconomically, racially, linguistically, by country of origin, documentation status. And they have an abundance of strengths, including cultural and linguistic and social strengths, as well, and we'll talk about this in a minute, a host of cognitive advantages associated with bilingualism that have so far gone untapped by the system. Next slide, please. So the research landscape, a lot of what we focused on is kind of dual language immersion and kind of bilingual learning opportunities. Why is that? Because the research is quite clear that dual language instruction creates lasting and wide-ranging benefits for all kids, whether they're DLLs or whether they're native English speakers. We know that in the kind of academic realm, DLLs in these programs are more likely to become proficient in English more quickly. They outperform their peers who are in English only or English-centered programs in math and reading. They reach academic norms and they become biliterate, which has a whole host of other positive outcomes associated with employment and with income later in life. Next slide. But we know that these benefits aren't just academic, right? Like children's positive racial socialization, feelings of belonging, pride in the home language, and all of these things affect social emotional development. They affect how kids, what kids associate with learning, right? If you feel valued, you feel like you're bringing something, you feel like all of your knowledge counts when you walk in the door and is recognized and celebrated and as a jumping off point, that's going to make a whole different learning environment for you than you would have if you walk in the door, you don't understand the language, you're treated as if you don't know anything, where you have a whole wealth of knowledge in your home language perhaps. It just completely changes the vibe, and it completely changes also kind of how we associate learning. Is learning going to be fun and something that is central to me, that I like to do, that I like to engage in? Or is it going to be something where I feel like I'm being put down or not valued or kind of secondary? So all of those pieces are kind of the less kind of the softer sides, but equally, if not more important, to why we kind of really look at DLI models and other models that are strength-based in this work. The other part of it is the family engagement, right? And the family partnerships and kind of those more direct opportunities to become involved in children's learning and development in these models that are really growing on children's home language. Unfortunately, there's some very limited and emerging data that finds that DLLs may be underrepresented in these types of learning approaches. Now, in some states, like my home state of Arizona, that's a result of misguided policy. In other places, like in DC, where I live now, part of it is low supply, high demand. And when that happens, higher resource, generally white, families tend to crowd out our DLLs. And so there is some evidence of that and a lot of anecdotal evidence of that happening. And so when we think about policies to expand access to DLI, equitable enrollment policies and recruitment policies and information policies have to be front and center. Now, based on everything that we've talked about, there are still really large gaps in the state in terms of our data with respect to DLLs and ECE programs across the different programs, and the number of actual DLI, dual language immersion slots that there are in the state. And so this kind of hampers our ability to really understand who has access now, who doesn't, where is there opportunity for expansion, where should we jump off from? So that is a significant problem. Next slide, please. So the policy landscape, and I'm just going to kind of skim through this a little bit because we're a little bit behind on time. But I think the main takeaway message here is that none of the programs, none of the early care and education systems within the state have a comprehensive set of policies to support DLLs. And some programs, like the various childcare systems, barely address DLL issues at all or barely mention DLL issues at all. So considering the population in California and that most children in the state are DLLs, the fact that it is such a patchwork system and really quite insufficient and inadequate in most of the systems is a huge and problematic equity gap. Next slide, please. But we know that there's been movement. There's been significant progress and movement, especially since Prop 58 passed in 2016. We know that the state has dedicated $20 million in funding for the DLL pilot. We know that there has been, some bills to establish dual language programs, but they have come without funding, which significantly hampers implementation. And there have been some other, efforts. There's some professional development grants, but really compared to kind of the scale of the need and the population in early care and education settings, these really don't add up or measure up to where we need to be. Next slide, please. So our recommendations for DLLs. Probably not surprisingly, increasing funding for early ed programs to transition to dual language immersion models wherever possible. And prioritizing programs serving the greatest number of DLLs. Again, keeping in mind that equity lens that DLI programs are highly desirable in a lot of places across the country. And if we are not intentional and explicit about our enrollment policies, they tend, in many places, as we've seen, at least anecdotally, DLLs tend to get crowded out. Conducting a statewide analysis identifying existing publicly funded early childhood programs who are engaging in DLI right now and who are providing bilingual learning and instruction to kids in the community. And so it's important to kind of know where these programs are, who they're serving, what slots are available, and what the demographics are within those slots. And it's related to this next one. So publishing a registry of dual language immersion programs, and partnering, here's another piece of the equity piece, right? Partnering with parent organizations and community-based organizations to ensure that families, especially immigrant families and families of DLLs, know about these programs. The other piece is getting our arms around how we define high quality dual language immersion, and getting our arms around quality control, right? Like not everything out there that provides some home language is the same thing. It is not all high quality dual language immersion. It is not all dual language immersion at all. And so really working together to identify and publish some kind of quality benchmarks for DLL dual language learning models in early childhood programs, and using these benchmarks to kind of conduct an analysis of the quality of existing slots, and then using that to deploy TA and workforce development support. The other piece of it, I think a huge gap is the lack of DLL specific knowledge and requirements within the standards of like across, like from the child development permit kind of all the way up. DLL knowledge in California or anywhere across the country should not be like an elective. It should not be an add-on. It should not be a thing you get to like at level 5. It should be like a base level part of kind of the information that folks get across all of the credentials. The other piece is addressing the data gaps. So there are some programs that have some data on the language background of kids. There are some that don't. So really implementing a standard basic home language survey and incorporating that into the enrollment process across all early childhood programs that are publicly funded. The next one is really requiring bilingual teaching staff if a certain threshold is met of DLLs. And we know that this there are specific considerations for family childcare and family friend and neighbor care for sure, but at least for centers when there's a threshold met to ensure that there's bilingual staff. Ensuring that all screening and assessment, including kindergarten readiness, are conducted in children's home language. Next slide. So I'm gonna just kind of skim these a little bit. Providing guidance to all state contracted early childhood providers who serve large proportions of DLL to really transition away from this kind of English only and English centered instruction and toward dual language strength-based approaches. As we talk about standards that we have in early childhood programs, Head Starts is far and away kind of the most kind of comprehensive and targeted set of standards we have for DLLs in early childhood. So really looking at adopting those or aligning as much as possible to that model that already exists out there for early childhood programs. Working with higher ed to make sure that, again, like all of this knowledge is embedded as part of basic preparation. And then again, like kind of encouraging localities and looking through all state level policies, QRIS and standards and monitoring and coaching and TA, and making sure that it is embedded at every part of the system, from the preparation and development to the technical assistance and training offered, to the accountability and the monitoring system and the standards, making sure that it is really a base part of every part of the system is really important. So I have gone over my time. I think that's my last slide. Next slide, Janico, please. Yeah, so you can find the link to the report here and our contact information. And I'm gonna stop talking and hand it back to Maida.
Thank you so much, Chantal. I think you shared a robust amount of information, but I think it really highlights the complexity of our children's lives and how important it is for our system to address that complexity in order to really truly meet the needs of our diverse population of young Californians. So thank you, thank you. I'm going to hand it right over to Carla Bryant to respond and share with us her perspective on where does California go from here.
Great, great. And again, thank you, Chantal. And I want to give special thanks to Myra and Emma for being great partners in this work of equity. But I'm going to move quickly because I know we're short on time. And I'm going to highlight 3 points that I got from not only reading the report, but I even got so much more just listening to Chantal talk about it. The first point is Equity is not a sidebar. It has to be infused in all of the work we do. If you're sitting in a room and equity is not part of the conversation, then it's incumbent on us to say something. We should look at all policies, all behaviors through that lens. That's the first thing. The second highlight for me was the report provided some very clear behaviors. Some of the problems, and I'm not even going to say a problem, but some of the struggles with talking about equity is that it is about a cultural change. It's about a shift in belief. But sometimes behaviors have to start as well. And the report provided us with those shifts. And if I may just take a quick moment, and I noticed that Catherine Goins, a good friend of mine, hi Catherine, in the question part, she asked a question about the elevation of the soft suspensions. And this is a conversation that I have with a lot of people because of my son. And I have to say, this is going to be the last time I talk about this. My son let me know that he did not appreciate me talking about him on these calls. But he was a preschooler that was suspended quietly from 3 different preschools. And at no time were we told he was suspended. We were told this was not a good fit. So I appreciate Chantel really bringing that out, that is something that we can absolutely, we can talk about now. And I think we can also quantify that. And I'm going to provide in a few seconds an example of how someone is quantifying the issue of the soft suspensions. The third thing that I think is highlighted in here is an opportunity. We have so many opportunities to actually act on the recommendations that have been provided in this report. And I'm going to provide those opportunities starting from the federal all the way down to the local. I don't know about the rest of you, and if there's someone on here that I'm saying something that is offensive, I apologize, but there is a lightness in the air on a federal level. And the opportunity now to have leadership that is going to be willing to engage in this equity conversation is exciting. But we also have this opportunity on a state level with our master plan. And I perceive our master plan as being a place where the plan will come out and then we will have a chance to respond and modify. So I'm looking at some of the ideas that are inside of this report and thinking these are some of the things that we should move forward. And a lot of them fit right into the work that Emma and Myra and I have been talking about, which is that whole child. The next place where the opportunities are on the local level. As I looked at some of the activities, some of this work is going on, but it's not visible. And part of our work is to elevate the work that is happening so others can come see. But to do that, that is where our next steps come in. And I know that through the master plan, through elevating the work that is happening out there, we will be able to highlight where in the governance structure that, and when I start talking governance, I'm starting to talk about budget and money, where we can absolutely look at how we are currently structured and are we structured in a way to be successful so we can carry out these recommendations. Those will be our next steps. And I'm going to stop there because I know we want to have time for at least 1 or 2 questions.
Thanks, Carla. Thank you so much. Let me hand it over to Emma and get us started and close us up afterwards.
Perfect. Yes, thank you all so much just for being here and just accolades to the folks putting this report together. I think it's really an important time to ground this conversation on equity as we build towards the master plan work in California. So I'm going to start off with a question for Carla. And I think there was some questions on how do we prioritize this work, and also just adding in something that I'm thinking about, right? When we think about COVID-19 and how it's really exacerbated the inequities that we do see across these 3 different issue areas, and how can we think about with the California state budget, with the the upcoming legislative cycle, what are the things, Carla, that you would offer as priority areas to think about for California from this report? How do we prioritize some of these conversations?
And I think a lot of that has been answered. If not answered, we can start answering that question by looking at our equity index that was actually created by the equity, the project, Emma, your team. It actually shows us where some of the deepest need is. And if we start there, we can absolutely go to those communities and find out of those three things, where is the best place to start their work. So where we should put and I'm going to keep saying this, we have to put our funds in these spaces. They will let us know which of the three makes sense to them.
Wonderful. There's lots of great chat questions, and we might not be able to get to all of them, but thank you all so much for your excitement around this work. The next question I'll take to Chantel. And this, I think, was a question around the DLL recommendations and analysis, and thinking about your focus. It seems like it was primarily on center-based programs, and thinking about what are the considerations that around home-based care as well for DLLs, if you were able to look into some of the data and policy recommendations for home-based care.
Yeah, no, that's a really great and really important question. We did not look into, with respect to the data analysis, the different types of settings. Some of our recommendations, I agree, are more geared towards standard, like the piece on bilingual staff. If there's a certain threshold or percentage of kids, that's obviously more feasible and makes more sense when there are more kids, not like 5 kids in a family childcare home. But I do think that a lot of the recommendations, especially the workforce development ones, are applicable across all settings. I think the training and TA system, I think the kind of the data pieces, a lot of these are really applicable and should be applicable. We shouldn't have kind of different sets of standards in terms of what supports folks are offered, what standards they have to meet, what kind of that baseline knowledge is. And kids should, have a high quality experience and a high quality provider, regardless of kind of they walk into a home setting, they walk into a center-based setting, and really making sure that we are equitable in the professional development resources and the delivery of those, and supporting family childcare providers and family-friendly neighbor providers, because we know a lot of our DLLs are, of course, in those very settings. And so I agree, some of the recommendations were more geared towards centers. A lot of the other ones are applicable and we think should really be applied across.
Awesome, thanks. I don't know, Carla, if you had a follow-up. I see you're unmuted, but if not, I can go on to the next question.
Oh, I had a follow-up. I'm sorry.
No, just I saw you were unmuted, but I'll go on to the next question. So I think the next question is around inclusion and how can we support providers and create kind of that system structure at the center-based, home-based early learning setting. And I know from when I worked in early Head Start, we had a specific individual that was specifically focused on supporting students with disabilities. And so someone noted that there's not that infrastructure at the state preschool level. So thinking about how do we build up our systems and support providers, provide training, what would you lift up at the statewide level that we can do as a focus to try to support providers with this work?
Yeah, I think that's a great question. I mean, I think what we're saying is, we're not saying kind of general early childhood systems, you guys do this on your own. We have a whole system of preschool special education, right? We have preschool special educators, we have early interventionists, we have a lot of money dedicated to those types of services. And so what we're saying is bring those together, bring that expertise from the preschool special educators, explore different models like itinerant teaching models, co-teaching models, consultation models, where we can kind of have shared learning opportunities and kind of partner up with those folks who have kind of that specialized disability training and the folks who have that kind of specialized general early childhood training. And so there are resources, there are personnel kind of in that system. And what we're saying is bring those systems together and stop kind of perpetuating and keeping them apart. There's also other supports, right? Like we mentioned, the state has actually passed, supported some money to go into this. So there is kind of some coaching infrastructure, there's professional development, not enough, of course, like I mentioned, not nearly enough, but a place to grow from that'll help. I think Head Start also does a really good job of this, as folks have mentioned, and so kind of also partnering with Head Start in that. So I think there are resources out there, not enough resources, and not everywhere where we need them, but there are enough places and there are resources within these systems that we can kind of bring together to create more inclusive settings for kids.
And if I may add on to that, is that these three issue areas are not mutually exclusive of each other. And therefore, the importance of supporting leadership cannot be discussed. And especially when we learn that some of our leadership moves into other spaces, we have to support on multiple levels. We have to support on the local level, in the center, in the district, but also there has to be a statewide understanding of how they're going to support leaders in general around how to do this work and bring it together in a very strategic fashion.
Yeah, and we didn't have a ton of time. We kind of jumped through it, but all of these are intersecting, right? Like there are Black children who have disabilities who are also overly harshly disciplined. There are DLLs who are also part of the preschool special ed system who, right, aren't getting the appropriate. So like many of these kind of overlap with one another and make up multiple systems of oppression that are kind of, placed one on top of another and are marginalizing too many kids. So.
Wonderful. So I think we are heading to our end of time. So I think I'll just close us out here by just extreme gratitude to the Children's Equity Project for this tremendous research, this report, these recommendations, for Myra and Carla bringing us together with this work. And for all of you joining us, because this conversation is so critical now as much as it was ever. And so as we think about moving forward, we'd love to work with you. So if you are interested in thinking about how can we move forward some of these recommendations, what would it look like to reimagine how we define need in our state and how we can really move some of those dollars, like Carla was saying, it requires that funding. It requires us to really acknowledge what are those systemic barriers that we have for our youngest children and families, and how are we going to fund in a new way that will change that underinvestment that we've seen historically. So we'd love to work with you. So here's all of our contact information. If you're interested in supporting some of this whole child equity work, please reach out to us. And thank you so much for your time. Be sure to check out the report. It has all of these great nuggets of information, data, landscape, and recommendations. Thank you so much.